we had done the excretory system, and especially we had discussed about the detailed account of kidney. Okay, so the structure and the functioning units of kidney. Today we will discuss some of the disorders that are associated with kidney. Okay, so here I have written the disorders of the kidney or excretory system or urinary system. Okay, so here we will discuss three common disorders. Along with this, again some more disorders are there, but these are some common and important disorders that about that we should know. Okay, the first one here we will discuss about urinary tract infection. In common, we can also call this UTI. UTI is the urinary tract infection, and it is very common nowadays. Okay, so urinary tract infection is normally caused by a bacteria known as E. coli. Okay, E. coli is a bacterium which is the main cause for the urinary tract infection. Sometimes when we take any contaminated food which may have the bacteria, then E. coli may enter from the digestive system to the excretory system, and it may cause infection in the urinary tract, and it leads to urinary tract infection. Remember, urinary tract infection is very common in female as compared to male. Okay, male also they got urinary tract infection, but it is very common in female. Okay, so the main cause for UTI is E. coli. So it also have so many symptoms like pain in the abdomen, in the lower abdomen. The patient will feel pain, irritation while urination. When you are urinating, you will feel a burning sensation. Okay, and also sometimes itching. Okay, these are some of the symptoms of UTI. So how we can prevent UTI? Especially it is highly recommended to take a lot of water. Okay, so when we will take lot of water, means we can able to flush out the bacteria from the urinary system. Okay, so it is recommended to take lots of water, and personal hygiene is a very important thing in UTI. Urinary tract infection can be prevented by personal hygiene. Sometimes due to bad hygiene, or if you are not maintaining a proper sanitation, then also you may have the UTI, urinary tract infection. So the first thing is you should drink a lot of water, then personal hygiene, and if it is needed, then some antibiotics are also there to cure the disease UTI. So it is a very common nowadays, but if it is untreated and left, it may cause damage in the urinary system. That's why it should be it is needed to be cured as earlier as it is possible. You should consult your doctor if you got UTI, and you need not to fear, and you should talk to your parents, or you can consult to your doctor. Got it? So this is all about UTI, urinary tract infection. The next one is kidney stone. It is also a very common disease. You all might have heard about kidney stone. So what is kidney stone? Already we have discussed that kidneys, there are so many filtering units in the kidney. What are the filtering units? We call it as nephron. If you all remember, nephrons are the small filtering units present inside kidneys which helps in the filtration of blood. Remember? So if I can show here I am drawing only a single kidney. Okay, this is the ureter. So there are number of small filtering unit. We call it as what? Nephron. Okay, so nephron helps in the filtration of blood. If the person he or she contains lot of mineral in the blood, then during filtration, by the continuous filtration, some mineral may occur, especially calcium. Okay, especially calcium oxalate or calcium phosphate. If in the blood there are high content of calcium oxalate and calcium phosphate, then during filtration of blood there may be the deposition of mineral and it will form stone. Okay, in the earlier stage it will form small stone, that's why it can able to pass into the ureter. This is the ureter, if you all remember, it will pass to the ureter. And when it will be in the small stage, this is the stone. Okay, so when it is in the small stage, by taking lot of water or by taking any medicine, it can be melted or it can be removed out from the ureter to the urinary bladder and it will remove out of the body. But if the size will increase, then it will block the passage of urine down and it will give a severe pain in the lower abdomen. Okay, due to the blockage of urine, there will be severe pain by the side of lower abdomen, by the any side of lower abdomen. Okay, and it will, when you will urinate, then urine may also have a foul smell, very bad smell, and the urine will be cloudy. Cloudy urine means whitish urine. Okay, not yellowish, so slightly whitish kind urine you may see. So this is the what kidney stone. If it is small, then it can be excreted out by taking a lot of water or by taking medicine. It can be melted by taking medicine. But if the size of stone is large, then urgently it need a surgical treatment. Okay, by the help of surgery, stone can be removed. You all might have heard about stone operation, kidney stone operation. If the size of the stone is large, then it can be removed by surgical operation. Okay, so it should be treated as earlier as it is possible, because if it will block the urine, then it may also damage the kidney. Okay, by the blocking of urine, it may also damage the kidney. That's why it should be treated earlier. Okay, so this is all about kidney stone. So what is the preventive measure? We should take lot of water. Okay, drinking lots of water will prevent your excretion related diseases. Remember, okay, at least 8 to 10 liters a day you should drink. UTI also can be prevented by drinking water, and kidney stone also can be prevented. You can maintain a healthy kidney by taking a lot of water, by drinking a lot of water. Okay, so this is about kidney stone. The next one is about kidney failure. Okay, this is also a very common disorder. You all might have heard about kidney failure. Suppose in case of any injury or in case of any infection in the kidney stops functioning, and at that time it is called kidney failure. If a person is suffering from kidney failure and both the kidneys are not functioning, then it is very essential to be the person should be transplant the kidney, means a new or healthy kidney can be implanted in the patient's body. But if the patient is suffering from kidney failure, and if one of the kidney is alright and another kidney is not functioning, then that person did not have to undergo any kidney transplantation, because a person may also survive by having single kidney. Okay, so kidney failure, if it occurs if both the kidney it fails, then it is very dangerous, and kidney failure can be treated by the two processes. The first one is dialysis and the second one is kidney transplant, as I said. So what is dialysis? Dialysis is a process in which artificial kidney is your body, to any of the part of your body. So what will happen? There will be a tubular connection to the body. Okay, suppose okay, you can see here in the image that if dialysis is a process in which the filtration of blood takes place artificially by the help of a artificial kidney. We can also call that artificial kidney as dialyzer. Okay, dialyzer is a artificial kidney, or it is a machine which is just fitted to the patient body, and it will filter the blood of the body, and the filtrate or the pure blood will be again what it will be transferred to the patient body. The unpure blood will be given to the dialyzer. Dialyzer will purify it, and it will again send that pure blood to the patient body. Okay, so this is all about dialysis. So if a person is having kidney failure, then number of times they need dialysis to filter the blood. Or else there is a second option, kidney transplantation. A healthy kidney can be donated to the patient. Okay, but there are again some more restrictions, like the blood groups should be matched, and some more other restrictions. Okay, so kidney transplant may also occur, and kidney transplant is nowadays it is a very common also, transplantation of kidney. The family, the relatives, they can transplant or they can donate kidney to the patient. And remember, a person can also survive with single kidney. Okay, need not to have two kidneys, but the life expectancy may reduce. Okay, but a person may survive with single kidney. Okay, so this is all about kidney failure. So again I am repeating, if you need a healthy kidney, then first step, you should drink sufficient water. Okay, and avoid taking mineral content food, like mostly calcium content. You should not take more salt. Okay, limited amount of salt you should take, and more mineral content water also you should not take. It will cause kidney stone. Got it? So this is all about some common disorders related to urinary system. Again, there are some more, but these are the most common disorders. Okay, again go through this. If you got any more doubt from this disorder, then again you can ask me again some more new disorder. If